The Queensland Premier Anastasia Palaszczuk says authorities are expecting a Brisbane doctor who contracted COVID-19 has the highly infectious UK variant. All hospitals, aged care and disability services in Greater Brisbane will be closed to visitors, and anyone who enters must wear a mask. With more, we're joined now by reporter Lily Nothling in Brisbane. Lily, what more can you tell us about what authorities are saying today?
Well, what we've learned is that the doctor assessed 2 COVID-positive patients with the UK strain of the virus here at the Princess Alexandra Hospital early Wednesday morning. She developed symptoms after her shift on Thursday and then was tested positive to COVID-19 on Friday. Now, she had not received the first dose of the vaccine. She was working with COVID patients, but only about half of the healthcare workers on the front line here at the hospital have been vaccinated so far, but health authorities say there wasn't any breach to PPE as far as they're aware, so they are trying to figure out how she was infected. Now, the health authorities have identified a number of high-risk sites, and that's because the doctor did travel out into the community on Thursday afternoon after her shift while unknowingly infectious. Those sites, the high-risk sites, include the Morning After Cafe in West End, the Corporate Box Gym at Coorparoo and the Stones Corner Hotel. And of course, anyone who was at those locations at the times where the woman was there will need to monitor their symptoms and go into quarantine. There are some low-risk sites as well, including the McDonald's drive-through, a McDonald's drive-through, so lots of information provided by health authorities today. But here's a little bit of what Dr. Sonia Bennett had to say a short time ago about this incident and the information that's unfolding.
That particular doctor was managing 2 patients that we know were confirmed to have COVID, and that was in the early hours of Wednesday morning. She did a subsequent shift at the PA hospital later that day into Thursday evening, and then late Thursday developed some very mild symptoms, and on waking Friday morning had a sore throat and did exactly the right thing and went and got tested immediately Friday morning, and the result was returned late Friday.
Dr. Sonia Bennett's there. Now, Lily, as contact tracing gets underway, what sort of precautionary measures are now in place?
Well, firstly, all hospitals, aged care facilities and disability facilities in the Greater Brisbane area will be closed to visitors, and everyone will have to wear masks. And of course, as we heard late yesterday, the PA hospital has gone into lockdown effective immediately. What that means is that non-essential visitors can't come here, that all staff members need to wear masks, as well as patients, unless there's a clinical reason why they can't. Elective surgeries have been postponed for the time being, and even though the emergency department here is still running, people are being encouraged to go to nearby hospitals or to see their GP if they have any health needs. However, they have stressed during this press conference, the health authorities have said that this doctor was only in the community for a limited time. They said she did the right thing to go get tested as soon as she developed symptoms, so the window of that infectious period is quite small, and that's giving them some hope as they continue to contact trace people at those exposure sites I mentioned earlier.
And Lily, you mentioned there that the doctor who has contracted the virus hadn't been vaccinated. How is the progress there on the vaccine rollout?
Well, as we know, the vaccine rollout began here in Queensland about 3 weeks ago, and during that time about half of the 1A group, so those are the essential workers, frontline workers, people working with people infected with COVID-19, have been vaccinated. Unfortunately, health authorities say this doctor was not one of those people. She would have been wearing PPE, they say, but something has occurred and she's become infected. Of course, COVID-19 is highly infectious, so they're just saying we need to, anyone in the community who develops any symptoms, especially people who've been to those exposure sites, do need to get tested and go into quarantine.
Lily Nothling reporting there in Brisbane.